Hello everyone, Dr.berkkkaratas. In the treatment of premature ejaculation, we continue with drug therapy. We can divide two categories in drug treatment. We can divide one of them into creams or sprays that are used locally, that is, applied only to the penis, and oral medications. Creams or sprays applied to the penis are sold in large quantities, especially on social media and on the internet. These are used only to numb the penis area and glands to feel less when the penis enters the vagina. About 10 to 20 minutes after intercourse, I usually recommend half an hour. It is used and is effective for up to 2 hours. When we used only this treatment alone, it increased the ejaculation time by an average of 2 to 3 times. It has been identified. In particular, we prefer creams with diaocin and purple together. We have a very good preparation for this in Turkey. There are 15 grams and 5 grams at Jetex. After these premature ejaculation videos are over, penis anus cream is applied on the model. I'm going to tell you about it for an early divorce. Of course, creams have a problem, and one of the most frequently asked questions is that I will apply cream. Will my partner's vagina also go numb? In other words, if you apply the cream in a very short period of time and then immediately have intercourse, then this is possible. I usually recommend the following to my patients: let's apply the cream 30 minutes before intercourse, a few minutes before intercourse, or 5 minutes before intercourse. We can wash our penis cursorily or pass a water. Therefore, we eliminate the possibility of numbness of your partner's vagina. Medications, that is, oral medicines, are divided into two. A group of drugs is used only before intercourse. Just like with erection drugs, these are one-time. It is enough to take it approximately 1 to 2 hours before intercourse or 3 hours before. Its effect lasts for 6 to 12 hours, after which it loses its effect. When we use this drug alone, it delays our ejaculation time by 2 to 3 times. The ingredients of this drug are depoxetine, that is currently the only drug produced for premature ejaculation in the world. All other drugs have been produced for other reasons. We also use them because they prevent premature ejaculation, but depoxetine is a drug produced only for premature ejaculation. We need to take the other oral medication group continuously. I usually recommend drinking one at night when I go to bed. They are independent of the relationship. It must be used for life. Its effect does not start immediately like other depoxide. It shows its maximum effect in the first week on average, but in the third week, they act as they are used. When we stop using this drug, the effect of this drug disappears and premature ejaculation may begin again. How long does it delay ejaculation? According to some studies, it is 2 times, according to some studies, 8 times. In particular, the paroxetine group from this group has been observed to prevent premature ejaculation 8 times in some studies. Of course, these paroxetine, sertraline, phyloxetine and citalopram groups write antidepressants on their drugs when you take them in your hands. Of course, we do not use them in terms of antidepressant properties, but when we use these drugs, there may be headache, dizziness, drowsiness the next day, especially in the first uses. I usually do not see these side effects in around 80% of my patients. It also appears to be serious in some patients. Then we may have to stop taking the drug. In general, drug treatments can be used alone. But of course, as you can see, they increase ejaculation by 2 to 3 times to the maximum. In other words, someone who ejaculates for 30 seconds can be 1 to 2 minutes at the end of this treatment. In some patients, we can really go up to 6 to 7 minutes. I do not use medication alone in my own practice. I usually prefer to use medication in combination with behavioral therapy. In our next video, we will continue with behavioral therapy for premature ejaculation. Thank you.